across this country of ours every day, there are doctors, there are nurses, there are medical support staff, there are healthcare workers, there are caretakers, and others who are getting up every day, leaving their own families, and going to work on behalf of members of other families. And too often, these men and women are doing so at great personal risk to their own health and, as it turns out, to the health of the ones that they love. But despite the grave risks to themselves, these heroes and heroines are undeterred. Day in and day out, week in and week out, they continue to serve others and continue to demonstrate by their own courage what leadership by example is all about. And for that, we are deeply, deeply grateful. Something that most Americans may not know is that 1 in 6 health care and social service workers, that's 1 in 6 healthcare and social service workers in this country, are immigrants. And when you add them all up, that's 3.1 million people who have chosen to make the United States their home and are giving back to their country, this country now, in profound ways. They are not a number. They are not a statistic. They are caring, courageous members of our own communities and of their own communities. Over the last 3.5 years, and even before that on the campaign trail, we heard Donald Trump and a number of the people around him demonize immigrants. He has used fear-mongering to claim that immigrants and dreamers are those young people brought here when they were kids, maybe younger than kids. But the president has spent for a amount of time fear-mongering to claim that those immigrants and dreamers are going to take all of our jobs away. And that just isn't true. I know a bunch of those dreamers. A lot of them were students at Delaware State University. They are students, young people that any parent would be proud to claim as their own. They're some of the finest young people I've ever met here or any place around the world. But while many Americans are rightly following stay-at-home orders, these men and women are often putting their own health and safety at risk to do some of the most critical jobs every day. I believe it's important that we recognize these immigrant health care heroes who are playing a truly critical role in the fight to protect their fellow Americans. I mentioned a minute ago that there are 3.1 million healthcare and social service workers in our country. Today, I want to highlight the story of one of them. Her name is Cesarina Ramirez. She's standing right here over my left shoulder. She's a nurse. She's a nurse at one of Delaware's federally qualified community health centers. It's called Westside Family Healthcare. They operate we only have 3 counties in Delaware. They're in northern Delaware, Newcastle County, where 2/3 of our residents live, and also in Kent County, which is where Dover is, the capital of our state, and Dover Air Force Base, maybe the finest Air Force base in the world. But Westside Family Care, like the nearly 1,400 federally qualified community health centers across the country, help to deliver quality primary care services in underserved areas every day, without a lot of fanfare, without a lot of acclaim. They do what my mother used to call the Lord's work. That's what she used to call it, the Lord's work. Cesarina and her colleagues in Wilmington have been serving our community throughout this COVID-19 pandemic. I just want to take the next several minutes to share with my colleagues and the American people a part of her story. Why she became a healthcare worker, why she continues this work now, and serving a largely, but not entirely, Spanish-speaking population, even during the hardest of times like the times we're living in today. What I'm going to do in the next several minutes is really to share with you Cesarina's story. Not in my words, in her words. And this is what she looks like. She works right in Wilmington, Delaware, not all that far where my wife and I live. And I probably met her a time or two. Didn't recognize her because she had her mask on here today. But the Delaware's a little state, so you meet just about everybody. But here's her story in her words. My name is Cesarina Ramirez. I was born in the Dominican Republic. My family came to the United States when I was 7 years old, and I am the oldest of 3 siblings. My father was a doctor in the Dominican Republic, and my mother was a teacher. As my dad got older and started our family, he couldn't help but notice all the corruption and crime that existed in the Dominican Republic. He wanted the American dream for his children, as did his wife, And so they decided to leave everything behind and move to this land of opportunity, the United States of America. My dad became a taxi driver. He was working overnight while going to school in the morning. After 3 years of hard work, he graduated with an associate's degree in radiology. Both of my parents are deceased now, she writes, but their courage and work ethic live on in each of their children. My siblings and I could not be more grateful for their unselfish decision they made for us. Cesarina goes on to say, I've been working for 10 years at Westside Family Healthcare, where I'm a team medical nurse. I educate patients about medical conditions to help them identify lifestyle changes that can benefit their overall health and goals. The one thing that I love the most about my job, the one thing I like the most about my job is that I'm able to make a difference in someone else's life. And I would just say, Cesarina, me too. Or as we say in Delaware, me también. As the years passed, I quickly learned about the demand for Spanish interpretation among our patient population. As a Hispanic, and with the Spanish being my first language, I realized that sometimes it is easier for a patient to speak in their native language when it comes to medical concerns. I like that I can be, she likes that she can be the voice of the patient and the #1 advocate. Cesarina goes on to say, I have observed instances of patients receiving care from a provider who has the same cultural background and speaks the same language, resulting in positive healthcare outcomes. In these cases, the patients appear relaxed, are willing to ask necessary questions to obtain knowledge, and there's a mutual understanding of goals and plans to improve patient care. Taking care, Cesarina says, taking care of patients is a privilege. Think about that. Taking care of patients is a privilege. I think it's a privilege to serve the people of Delaware and our country. She feels that way about her patients. And looking at the difference in the amount of help that can be provided to the community has truly been an inspiration to work hard and try to be the best nurse I could be. And that is the end, if you will, of what she has said, and that I wanted to share with all of you today. Let me just say, I don't know if Cesarina will see these proceedings or hear my words or hear her words through me, but I just want to say thank you for that message, Cesarina. Thank you for that message. Thank you for all you're doing to serve our community in Delaware, even during these most difficult and challenging times. The United States and the First State are more than lucky. We are blessed that you're on our team in this fight against the coronavirus. And to all the other immigrant healthcare heroes who are serving their fellow Americans throughout this country, and to those who were fortunate enough to have been born here and serve, we salute you. We salute you. We thank you for looking out for the rest of us so that we might enjoy the blessings of life, liberty, and the pursuit of happiness. We are better for having you here among us. We appreciate the life-saving care you are providing for so many of us. If you are out there here within the sound of my voice and you are an immigrant healthcare hero, or if you know someone who is, I would encourage you to share your story with us on Twitter or Facebook. Just use the hashtag Immigrant Healthcare Hero. I'm going to say that again. Just use the hashtag Immigrant Healthcare Hero. We'd love to highlight your story and thank you as well.